Hello everyone, my name is Dr. Terri Gibson with American Animal Eye Care Center in La Habra, California. I've been a veterinary ophthalmologist for 17 years and I love what I do. One of the most commonly asked questions I hear from clients is, does my pet have dry eye? Dry eye is a decrease or lack of tear production. Common clinical signs we see is conjunctival redness, squinting or constant blinking of the eye to the eye being completely closed, a thick discharge which is often adhered to the cornea and the eyelids, and the discharge can be yellow or green in color. This indicates a secondary bacterial infection. Corneal blood vessels, pigmentation, and scarring are often seen associated with the disease, especially in the more chronic cases. Predisposed breeds that we see dry eye in include the English Bulldog, American Cocker Spaniels, Poodles, Westhighland White Terriers, Shih Tzus, and Lhasa Apsos. The causes include immune-mediated, and oftentimes if this is the cause, treatment is necessary for the rest of the pet's life. It could also be congenital, meaning the animal is born with it. It could be drug-induced. Certain types of drugs, topically or orally, can cause dry eye, but oftentimes the tear production will return to normal once the medication is stopped. It could also be neurogenic in cause. So oftentimes when the facial nerve is paralyzed, we will see dry eye develop. And it can also be surgery induced. If the gland of the third eyelid is prolapsed, then prolonged prolapse can cause dry eye, or certainly if the gland is cut out instead of surgically replaced, that can cause dry eye as well. The diagnosis of dry eye includes checking the Schirmer tear test, which is basically a test to check the tear production, and we also take into consideration the clinical signs. Once the diagnosis is made, then appropriate treatment is started. I often will stain the pet's eyes too because corneal ulcers or scratches are often associated with dry eye. And if the ulcer is deep enough, then surgery would be recommended to help repair the ulcer. Medical treatment typically consists of several items. All of them are needed depending on how severe the situation is. One is an eye wash to help remove all the thick, sticky discharge that we often see associated with dry eye. And the second item is a medication, oftentimes cyclosporin or tacrolimus, to help actually stimulate or increase the tear production. Then we also use a topical antibiotic or an antibiotic steroid combination if there are no ulcers to help treat the secondary bacterial infection that we often see associated with dry eye. And then, of course, we use an artificial tears lubricant, which can be a gel or a drop. I typically like to use ointments or gels to treat dry eye because they have longer contact time on the cornea. Medical treatment is started, and then it's important to have the eyes reevaluated because you can't just look at the eye without doing the tear production test and say that the tear production is normal. So treating as prescribed and returning for reevaluation with checking of the tear production is very important to monitor the condition. And oftentimes when the tear production improves and is normal, we can stop some of the medications and or decrease the frequency. However, the cyclosporin or tacrolimus is often used long term. If medical treatment does not work, then surgery in the form of a parotid duct transposition can be performed. But typically we try medical treatment first and then we consider surgery if medical treatment does not work. And even with surgery, sometimes a medication or two is often needed. American Animal Eye Care Center can be reached at 562-943-3728, or you can visit us on our website at www.americananimaleye.com, and I is spelled E-Y-E. Give us a call and see the difference. It's been a pleasure talking to you all today, and I look forward to talking with some of you soon. Goodbye.